A very serious situation unfolding today here in Middle Tennessee as a number of hospitals now say they are at capacity due to the COVID-19 pandemic. Welcome to News 2 at 10. I'm Bob Mueller. News 2's Brooke Reese explains how the Delta variant is overwhelming our healthcare system.
Well, it's happening once again here in Middle Tennessee. COVID-19 is taking over our hospitals. Here at Vanderbilt University Medical Center, they say that both their ICU and emergency room beds are now at full capacity because of the Delta variant. It's putting a strain on staffing and supply as Delta limits the elective cases that Vanderbilt can take. And the hospital can no longer fulfill transfer requests from other medical centers. Vanderbilt says it's become challenging to balance the load around the city. And it's the same for other areas here in Middle Tennessee. At Ascension St. Thomas, ICU capacity is a fluid process that is becoming a, quote, growing concern as we admit and care for increasing numbers of critically ill COVID inpatients. Sumner Regional Medical Center's Chief Medical Officer Jeff Lifforth said at his hospital there are no beds, saying across the mid-state it is, quote, impossible to find an empty, staffed ICU, ER, or med-surg bed, all because the Delta variant has, quote, burned through us with a ferocity that is hard to describe. He says while the vaccines are not perfect, there is a reason why 96% of physicians got their dose. Vanderbilt, of course, continuing to encourage people to get vaccinated at this time, as the majority of the patients that they are seeing that are very sick are unvaccinated and in their early to mid-20s. From Vanderbilt tonight, Brooke Reese, News 2.
Now, Vanderbilt said around 90% of their critically ill cases are from unvaccinated people, but there are some who have gotten their vaccination shots. The hospital says those people are also severely immunocompromised.